Give us an idea. First, what was his injury for Aaron Rodgers? How was his? What would we look for in case we had that similar time of injury that he had in his Achilles?
So he tore his Achilles tendon, which is if you take the muscle in the back of the calf, that's your gastroc and soleus, two very strong muscles that push off when you're walking or sprinting or running or jumping. And then it comes down and becomes a tendon which attaches to your heel bone called the calcaneus. So that's the tendon on the back of your ankle. You can go down and squeeze the back, and you can feel that tendon. It's a very large rope. It's the largest tendon that we have in the body. And it generally injures in what we call an eccentric load, which is as the muscle is lengthening. So it's a quick jump, a quick sprint, a quick push off, and it can tear. It usually is something that happens very unusual in adolescent sports, but we do see it over here at Clemson. In actually our cheerleading population is probably the highest population of injury because they're doing their spring on a hard surface, not like the gymnasts. They're doing it on the hard surface, either on the field or on the basketball court where they're doing the spring activity. But you can tear your Achilles tendon, which is in general can be a devastating injury. Obviously, that's going to shut you down, and does at that age, at that population of elite athlete, it is something that we do repair.
All right, I've heard this before. Thank goodness, knock on wood, I've never had any Achilles injuries in the past. But I've heard it before where someone said, this felt like someone has kicked me back there. I've also heard that one of my friends, I had to worry about his pain tolerance level, said, man, I'm telling you, it was excruciating pain. Does that make sense? It is a wide variety when we first incur the injury, to have a variety of what it might feel like and noticing what that looks like?
No, you just described it perfectly. Most people you snapped a big rope. And so just imagine in your mind, if you're doing a tug of war and that rope snaps as you're pulling really hard on it, you can imagine what that feels. And then the calf muscle contracts up, and you can obviously see it on some of the injury videos as they slow it down. You can see the muscle kind of wave as it moves on up, and it's an Achilles tendon rupture at that point in time. Yeah, it feels just like you got a baseball bat swung and hit right in the back of your calf.
Is there a difference in a rupture and say partially, or are all of them ruptures? Do we kind of have other injuries to the Achilles?
So the vast majority of people get what's called tendinopathy of the Achilles. That's a condition you hear of tendinitis. That's inflammation of the tendon or around the tendon, and then tendinopathy is basically where the rope degenerates or frays, usually in the center part of it, and it causes chronic pain. That's the more common condition. And then there's the ultimate failure, which is the rupture. So tendinitis, tendinopathy, which is the wear, and then rupture as you go up that spectrum.
All right, so Aaron Rodgers, I want to make sure I'm saying this. Aaron Rodgers is no spring chicken himself. He's 40 years old. You just made mention to it. At what ages would we start thinking or feeling or maybe being a little more aware of an Achilles situation?
Most of the tendinopathies occur in middle age. Okay. So, and I'm not going to define.
I was going to say, Doc, I'm 55 years old, man. Be careful here. Right. Be careful.
Middle age is 35 to 55 then. So, right. So you're right at the cusp of that. No, I'm just kidding. But because of the techniques that we have now, specifically what was done with Aaron Rodgers, which is, I'm going to say minimally invasive. It's done to a very small incision, 2 to 3 centimeters incision at most. We use a guide that we're able to pass sutures into the tendon through that small incision, and then they're attached down to the calcaneus directly, bypassing the repair site. And so with that technique, we've eliminated a lot of the older complications of the surgery, and so we're starting to use that technique in older and older patients because we're able to get better functional results, to be honest with you. I'll give you just some, these are general non-specific examples, but, one of our football guys back at 4 months, one of our cheerleaders back on the field for senior day at 12 weeks, one of my older physician patients who was back to work at 2 weeks, and he was riding a bicycle at 8 weeks. And so it's not just about returning Aaron Rodgers back to, NFL professional sports. It's returning people back to life.